From the beginning till the end of the digestive tract, if internal bleeding is there, within 15 days that bleeding stops because it is hemostatic. If ulcers are there, it will take 1 month to 6 months. Any type of worms inside, they will be driven out. Any disease caused by viruses, bacteria, protozoa is cured by this. Chikungunya, dengue fever, H1N1, swine flu, herpes, hepatitis, rheumatoid arthritis, ulcerative colitis, gastritis caused by Helicobacter pylori, TB, typhoid, cholera, amoebiasis, and then drug-resistant malaria. Any other disease which you know caused by viruses, bacteria, protozoa, you add to the list. It will get cured. Among them, herpes, hepatitis, rheumatoid arthritis, ulcerative colitis, Helicobacter pylori. No standard medicine at present. All our patients are happy today. Herpes gets cured in 1 month's time. Still some residual effects will be there. It will take another 6 months. Completely cured. Hepatitis B and C, viral load is in crores. 3 crores, 5 crores, 10 crores like that. Doctors hesitate to touch the patient because once they get infected, a lifelong they have to suffer. So they avoid. Our patients, once they start taking it, in about 6 months' time, that crores together viral count becomes less than 20. The same doctors are telling that it is a wonder medicine. There is a big hospital in Chennai, Madras Medical Mission. It is a branch of Vellore Medical College Hospital. The director sends his patients here with a letter stating that it is a wonder medicine. Till today I have not seen the director, I have not seen that hospital. All his patients are happy. Rheumatoid arthritis. Patient feels it difficult to bend the fingers, bend the elbows, bend the knees. Even walking on the plain ground itself is a big punishment. Our patients, in 6 months' time, they easily climb 2 floors and attend to their work, sit on the floor and attend to their work. Ulcerative colitis, Helicobacter pylori, always hyperacidity. Doctors say you have to eat a bland diet, sapahara, no spices, condiment, nothing. From morning till evening, you must go on eating those antacid tablets, Rantac, Pentac, Omesh, or drink Gelusil, Digel, and live with it. Patients have been living like that for 20 years, 25 years. Once they start taking it, in about 6 months' time, they get cured completely. They start regularly eating puliyogare, bisbelebath, masala dosa, mirchi bhaji, and come and report to me. It is all God's grace and Mother Simarouba's blessings. One Mr. Rajiv Rangarajan, he is a bank officer in London. 5 years he was suffering from ulcerative colitis. He has shown to all important doctors there. They told you have to live with it. His parents are here in Malleshwaram. Here also he has shown to all the doctors. They also told the same thing. On one occasion when he visited his parents, he came along with his mother Radha Rangarajan, took the medicine and then went. Next visit after 6 months he comes with the folded hands. I got cured. Whenever Radha Rangarajan goes to London, she picks up a packet and then goes. Mother is very happy. What else can be there for a mother to be happy? One doctor, Krishna is there, allopathic doctor in Vidyaranyapuram, here only in Bangalore. He is having his own clinic, Saptagiri clinic. His wife was suffering from Helicobacter pylori infection for the past 10 years. Being there in the medical field, he has shown to all important doctors. They told, nothing can be done. She has to live like this. Somebody suggested him, both husband and wife came here, sat like this, then took the medicine and went. 1 month later, he comes with the folded hands. Not only Helicobacter pylori problems, sir, she had developed so many allergy problems because of that. All those are also cured now. Again, it is God's grace and Mother Simarouba's blessings. Cancer first and second stage, alone it will cure, no need of any other medicine. Some cancers we come to know very, very early. Mouth cancer up to throat, including the nasal passage, any part of mouth. Then esophagus cancer, even drinking water becomes difficult. Then ladies, breast cancer, lump formation. Gents, old age, prostate gland cancer, urination problem. In all these cases, immediately after knowing, you start it. In 1 month's time, improvement is seen. By the end of 1 year, more than 90% cured. No surgery, chemotherapy, radiation, hormonal therapy. Leave aside saving the money. You have spared the patient from physical and mental suffering, and you have spared all the members of the family from mental trauma. One Mr. Deen Dayal, a lawyer by profession, from Madurai, Tamil Nadu, left margin of the tongue cancer. Doctors told him surgery, chemotherapy, radiation. For a lawyer, if tongue is cut, what is the future? At the right moment he came, sat here, took this, everything. After drinking this one, he started doubting whether this simple decoction can it cure such a horrible disease. Then he told me, I will try for only 1 month, sir. Hope it will not spread at least. Then I told, okay, you can take for 1 month. 1 month over, he came running from Madurai. Sir, not even one day I have left my court work. It is already shrinking. But every month I can't come, sir. I am a very busy man. Can you give me for 5 months? He took 5 months medicine. Afterwards, his assistant is coming and taking his. He is saying that his boss is so busy he can't come out of Madurai now. More than 90% cured, everything is happy. Ladies come here with a 3 to 4 centimeter big lump. It disappears within 1 year. If it is still bigger, it may take another year. Yesterday, I received a call from a very important lady. 6 years over. She reminded me, Bhaiya, 6 years over. No trace of cancer. They had told me surgery, chemotherapy, radiation. I have taken nothing. I believed your words and I have got faith in Mother Simarouba. 6 years over. I wanted to just remind you, today is the date on which I had come first time with you. That's okay, fine. Then gents also like that. Within 1 year, prostate, it comes to normalcy.
Sir, at this I just want one. Should I ask you something now?
Later.
Okay.
Later.
Okay.
Keep the questions to the last.
Okay.
If the tumor is quite big and if it is third and fourth stage, no alternative. Chemotherapy has to be given. With that chemotherapy, the size of the tumor gets reduced. Then surgery, again chemotherapy, radiation. We suggest them to start this one before first chemotherapy itself, continue parallel with it, so that the side effects of chemotherapy will be as less as possible. Vomiting sensation will be less, appetite will be more, food intake is good, energy level is high, rate of recovery is fast. Well, that's what we want. In so many cases where the doctors had told only a few months left, already years have passed, still they are doing well. Again, it is Mother Simarouba's blessings. There are certain cancers where chemotherapy is the only solution. They are blood cancers. Again, classification, lymphomas and then leukemias. Lymphomas, Hodgkin's lymphoma, non-Hodgkin's lymphoma and multiple myeloma. Leukemias, acute leukemia, chronic leukemia. When the patient goes with this sort of disease, the doctors separately talk among themselves, this is a gone case. All our lymphoma patients, all our leukemia patients are doing very well. Among lymphomas, non-Hodgkin's lymphoma, patients who have been sent back from Tata Memorial Center, they are doing very well now. Once in a while they go there to show to the doctors, I have come back, alive now. Multiple myeloma is the bone marrow cancer. Bones become very, very soft. Patient cannot sit like this also because vertebral column gets compressed. Give chemotherapy, the patient becomes completely bedridden. Afterwards, the patient will not get up. But our patients, once they start taking it, in 6 months' time, they start going for regular walking. If they have come at the right and appropriate time, they go for even jogging and trekking. I can't believe all these things. They themselves will come here and then say, I am going for a trekking now. I have to believe. About 30 patients are there with multiple myeloma. Not even one failure is there. All of them are doing very well today. Similarly, leukemias, chronic leukemia and then acute leukemia. Both of them are doing very well. After spending lakhs of rupees, they come here. As a last resort, just to try this, not beyond this. And afterwards, youngsters, they go to the colleges or the schools. Elders, they report back to their duties. They come here and then tell, you have saved my family. Then I tell, Mother Simarouba has saved your family, not I. I am an ordinary person just like any one of you. For brain cancer, chemotherapy doesn't reach. This reaches. We have got glioblastoma, angioma, all those patients. Chemotherapy doesn't reach, but this has reached. They are doing very well. I have to believe all these things because the patients themselves come here and then tell, we are doing well. Apart from cancer, a few ladies' problems. Irregular periods, painful periods, cramps during periods, excess bleeding, white discharge, menopause problem, cysts in the ovary, fibrosis in the uterus and urinary tract infections. All these are taken care of. Put them together, more than 60% of human ailments are taken care of by a single plant. It's a great plant. Can we prevent all these things? That is the next step. For long term, certainly we can prevent. From the age of 1 itself, everybody can take it as a course for 15 days continuously and repeat it once in 6 months. If the family history is having cancer, instead of 15 days, make it 30 days. For example, entire January, entire June, like that. Or as per your convenience, you can reschedule the timings. If it is done like that, it gives resistance to all viral, bacterial, protozoal diseases, and your immunity level is so high that it is lifetime insurance against any type of cancer. If that has to be practiced, one plant is necessary to take care of one person. If one plant can take care of one person can also take care of one plant. We give you seeds, we teach you how to grow it and then how to use it. This is all free. Land we don't give you. How much land you need? 2 feet by 2 feet land you need. You grow it. After 5 years you start taking leaf, stick from the same plant. Dry them in morning and evening sunlight. Powder them in mixie and use in the same way as I am going to tell you. The same results you will get. If everyone starts growing it and then using it like that, a day will come in future that the whole world will be cancer free. Each one of you is capable of doing it. Don't think that only specialists can do it. All of you are specialists. All of you are Mother Simarouba's children. Each one of you is capable of doing it. You do it. Now you have consumed the decoction. Is it all right for drinking?
Perfect.
This decoction?
Absolutely.
No problem?
Absolutely.
Amma, this is about 60 ml. It is available in the international market in 60 ml bottles for sale under the brand name Simarouba Extract. Its market price is $23. That's about 1,600 rupees. Each one of you has consumed that much. Don't worry, I will not ask you to pay the bill. This much we advise for a patient weighing 10 kilogram body weight to take every day. If your patient is around 60 kg, every day your patient will consume about 10,000 rupees worth of medicine, which amounts to 3 lakhs rupees per month, and we charge 1,000 rupees per month. That is the labor charge we are collecting, not the cost of the medicine, not the consultation fees, and not the royalty for the research work which my wife and myself have done for the past 27 years. We are grateful to that great Almighty for giving us that much of time to study. Very rarely the people will give that much of time, and we got it. We are grateful to Him. Above that one, Mother Simarouba was kind enough to teach us all these things. If she had not taught us, what we would have done? We are ever grateful to her.